Hi, I'm Dr. Craig Tuttle. I want to welcome you to our office today. We're going to talk about a popular subject called arthritis. And arthritis is actually two words. I'm going to draw on the board here. The word arth, A-R-T-H, means joint, and itis means inflammation. So the body, the most common type, there's different types of arthritis, but the most common type that most people think of is osteoarthritis, which means bone, joint inflammation. So which usually occurs from wear and tear and overuse type injuries or trauma. But typically what happens is two bones come together. We draw two bones here. Let's say that's a bone and that's a bone. And those bones are held together by muscles and ligaments. And those muscles and ligaments start to tighten up and become constricted or tight, causing the two bones to not be as flexible as they normally would be. And those are the soft tissues, the blue being the bones and the red being the soft tissues, the muscles and ligaments. And those muscle ligaments tighten up from usually repetitive use or a trauma to, let's say, a finger or to one of the vertebrae of the neck or back from maybe a car accident or some type of sports activity. And then those muscle ligaments tightening up, causing a lack of mobility, which then creates an inflammatory reaction, thus you have joint inflammation. On an x-ray, what that does, it shows up, here's a picture of a neck here, and you can see this is a side view of a neck, and these are individual segments, the 7 bones that support the weight of a head. And normally each of these bones should have a smooth and regular shape. They should be square, kind of like if you were tracing a picture, you'd expect to see nice 90-degree corners on a picture. Well, in this particular case, you can see the bones have lost their shape. These things growing up out at the corners are called bone spurs or calcium deposits. That's the body's attempt to protect itself by forming this extra calcium and cause the joints to want to lock or start to slowly fuse and lock together. This picture I'm going to show you over here, these are side views of necks right here. Each of these segments are called the vertebrae of a spine. And this is, you'll see it says smooth and regular. So these are textbook, normal, nice vertebrae with nice equal pads between the bones called discs. Here in phase 1, a typical person between birth and age 20, as they age, the bones will start to develop little tiny spurs on the corners of the bone. And then we get into phase 2, which is between 20 and 40, typical time frame age-wise. And then those spurs start to get bigger. And then into phase 3, after age 40, between 40 and 65, a lot of times the bones will start literally growing together. They call that bridging or locking. And then last thing is like a Ziploc bag, it will fuse and lock together the vertebrae of the spine, or it could be the fingers of your finger, the individual bones of your hand, the finger joints. And the body will go through this decay process as a means to protect itself. So the old philosophy it still applies today, is to move it or lose it. The key with osteoarthritis is to stay active with your mobility as far as exercise is concerned, but also passively to get the bones unstuck. And a chiropractor calls that an adjustment or movement to unlock the joints to get the body mechanically moving again. It stops the calcium deposits and keeps the body mobile and functional. That's a little bit about arthritis today, and I wanted to talk to you about that and welcome you to our office and to oversee what causes arthritis, what does it look like, and what happens to the body and how to prevent it. And if you have any questions, we'd be happy to answer any questions you have. You can email my office, or you can get in contact with my office through our website. That's YourSeattleChiropractor.com. If you have arthritis or you'd like to have yourself checked or someone you know that you love and care about, you can have them get an examination. If you'll go to our site, we'll have a free examination coupon for you there. And thank you for your time today.